Hello everyone, good morning. My name is Osama, and today I will show you my work about the influenza, which consists of preparing for the next wave of influenza. So, as we know, the influenza it's really dangerous for our health, which can cause disease for a group of people. uh, as well as it transforms the hospital into high pressure and can cause can which can impact the cleaning the hospital and yeah. So a lot of vulnerable population, as we said, a lot of vulnerable population uh, should be detected. So that's why our work here, our mission is to know uh, what kind of group of people are vulnerable. So it can be the children, the elderly, or the other group of people, as well as we should anticipate to deploy the right staff in the right place and at the right time. So here is our mission in this project, and then turning this pressure into protection. So our work was doing using a tableau public, and consists of 6 slides, reaching graphs that allow for a clear understanding of the current situation and will thus help in making a confident decision. So let's start by identifying the most affected by influenza. The most affected age group here, I mean. So, so that's why we did a bar chart which contain three age group. We divided the age group in three group. Here we see the under 5 years, between 5 and 64 years, and finally those over 65 years. So as we see here, the difference between the age group is very, very clear. So here we can see those over 65 years old are the most vulnerable. Here we see the death rate among 2009, among 8 years, between 2009 and 2017. Here we see how those over 65 years old are vulnerable. So we can conclude that we should affect professional staff for those over 65 years old to take care about this kind of age group. It can be, for example, it can be a geriatric if possible. So we should implement a professional staff for those over 65 years old. So after identifying the most vulnerable age group, we need to find the areas most affected by influenza. And that's why here we conducted a spatial study covering the entire map of United States. And here we have the total population and the total death. The total population with blue and the total death. As you see here, the most affected state with the big bubble. So we can say that the most affected states are California, New York, and for example Texas. So this state said that we have a critical situation in influenza. So this state needs to be privileged, and so that's why we should prioritize this state and without forgetting the other state which shows remain pale, as we see here. We did the bar chart, which contain the whole state with with the population and with death. So here we see the most populated state and their relative death. So we can say through this chart we can say that the more populated the state is, the heavier the burden. So our next step in this project is to determine when we need to prioritize the staffing, specifically which month. Here we should know in which month the influenza appear. So naturally the influenza didn't appear in the whole month of the year. So it wave. So it can be for example in March or in January. So that's why we should know when it comes, so that we can allocate the staff in this month, and then we get prepared. Before the coming month. So here we did the bar chart. With the death of those over 65 years old by month. And as we see here, there is a peak in April. Always there is a peak. There is a peak in April during the 8 year between 2009 and 2017. Here we see 2009, there is peak in April, 2010, 2011, always. So that's why we can say April doesn't whisper, it shoots. And then we should allocate the staff specifically in this month, but we should not forget the other month, like August January, February, and December. So we did the trend line of each state. Here we see California. For each peak we see in each year we see a peak in April. This peak is in April. So to recap, let's go to our overview. To our overview of pressure point. So we can say that the larger a place population and the greater economic activity, the more is exposed to enormous pressure. So here we said that the greater economic activity, because New York it's have high economic activity, and so that's why it have a high rate of death. So we can conclude that the larger place population and the greater economic activity, the more it's exposed to enormous pressure, and thus the more death there are actually. So therefore we should focus on allocating professional staff for geriatric care, as we said, geriatric care if possible, and distribute them primarily California, New York, Texas during April, August, and January. So we should not forget the other month. The other state. We should not forget the other states. So, having identified the pressure hotspot, their location, and when they act, we can only recommend and state that the large states with significant economic activity have experienced high pressure over the past few years, so we must prioritize them without forgetting the other. Also, we should anticipate April peaks and implement specific plans for April, the identified critical month, as we said. Yes. So, to move forward, it's imperative to anticipate the April overload, and staff deployment must be aligning with the seasonal peak at the same time. At the same time, vaccination campaign and staffing should be coordinating to turn pressure onto protection. So that's how we can turn the pressure into protection. So here we are in the last step of the presentation of our project, and we should recognize the limitation of our project, so much of the data is missing, which may affect the accuracy of the result. So we had a good result, a true result, which are tested with statistical tools, and our results are good, but it can be, our result can be more their accuracy can be more better. So as well as the analysis is based on quantitative figure. So here we have we don't have a feedback from the field. For example, the staff the staff or the other. So that reduce the human dimension of the story. Yes, so here we achieve our project, and we want to thank you for showing our video, and see you in the next project. Thank you very much, and bye bye.